Is that somebody at the door?
Yeah, that was good. Spike told me. He came off.
I should be. Do you need Quizlet or whatever it was? No. That last time.
Well, I mean, we can do the same.
I think that was fine.
I did not come here.
What?
He goes, I'm gonna start off the conference.
You don't have Okay, if I may have your attention, please, I would like to introduce Calvin Vandergrift, who is a graduate of Stokes Early College back in, 1957? It wasn't that long ago, and it's actually tragic because he and I had dinner with Cold Walk the other night, and I thought that he graduated 10 years ago, but it was only 2. So anyhow, when did you graduate? 2018. 2018. So that was all of 10 years ago.
Feels
That's good. So you graduated in 2018, and I'm not gonna. Well, I will. You went to High Point University and did Did you do a 5-year program?
Usually pharmacy school is 2 + 4, 6 years. I did it in 5 because of Early College. So.
Oh, okay. So it's a 6-year program. I mean, what I talk to them about, sometimes they have 5-year programs, and where you enter as a undergraduate student, and you go straight into the master's program. You have an MAT, Master of Arts in Teaching, which is a 5-year program. And I thought maybe your program has a 5-year aspect of it. I don't know. And yours might too, right? Pardon? There's a possibility. Someone's going to go into engineering, and they have a 2+2 program in engineering, a 3+1 program in engineering, or an even 3+2 program where you come out with your master's degree in engineering. But anyhow, these are all things that we're talking about. Now, Calvin left and went to High Point University and then went to pharmacy school there. And so he's going to tell you about life. Now, I didn't prepare any questions for you because what happened was last time I prepared questions and then Jack asked 157.
Isn't that the point?
Yes, the point is that see, little has changed. Students are still disrespectful to the old man. But anyhow, so no. So yes. And so Jack has lots of questions. So if we need to generate some AI-generated questions, they said yes.
Everybody.
Okay. Well, anyhow. Well, okay.
We can do that.
Yes. Hold it up and make them do a test. Anyhow, I'll turn it over to Calvin. So this is Mr. Dr. Calvin Vandergrift. He is a doctor.
I am. As is Dr. Yes.
As am I, but only person that's called me
But he'll
that
kill
so
us.
John.
Yeah, he'll kill us if we call you that.
I don't. You can call me anything you want to. I just don't have you call me that because it's I think I'm better than everybody else here,
He's like a
and I don't. I mean, they're math teachers, right? I can't do math. They're smart. They can do math and stuff, right? I can't even help a 5th grader with their math. But anyhow,
I only count 5 pills at a time.
okay, he can only. Yeah, you have an abacus.
Yeah.
He uses an abacus to count pills. So anyhow, wait a minute. That implies that you're a pill pusher?
Well, is that something we should back then?
Whoa. Okay. Jack will.
We can talk.
Yeah. So tell us about your life.
Conundrum there. And that's unfortunately one of the things that goes on. Yeah, our cuts are bad. It normally ramps up, you get hours during flu season because you have to. Otherwise, sometimes you just be drowning in the pharmacy. And flu season's right now, so that's one of the most vital times that you can work in a pharmacy. There's a lot of things that come to that: shot season, flu season, COVID shots. Usually, anybody can get a tetanus shot, for example, at any point throughout the year. But most of the time, people just wait until, it's flu season, I'll get that. So sometimes there's an added pressure during these months, and that's when hours get kind of ramped back What else should I talk about?
Well,
Yes.
So do you only deal with like prescribing medicines and everything, and like people coming in sick? Is there any other aspects to it that you treat?
Absolutely, absolutely. So there's a lot of things that you do as a pharmacist. You help people with their acute conditions. I'm sick. I need an antibiotic or something. That's one of the most common things that you'll see. But a lot of people, your parents or your grandparents are on medicines that help keep them going every single day. Things that you probably hear about,
yeah,
but
that's
as
nothing to be.
16, 17, 18-year-olds, you probably don't worry about cholesterol levels. Unless you're a type 1 diabetic, most of the time blood sugars, blood pressure, all these things require medicines to keep them going. And that's kind of what you deal with on an everyday basis. There's a growing thing in pharmacy that's really interesting, starting to expand. Used to be when you have an ailment, you just have to go to the doctor. There's no one else you can go to. I'm sick, I have to go to my doctor's office, right? It's starting to change a little bit in pharmacy, where more and more states are allowing for expansion in healthcare. And what that means is, myself, as a pharmacist, just in North Carolina alone, we've gotten the ability to prescribe birth control. We've been able to, therapies for patients who have been exposed to HIV, for that. For a certain time during the height of COVID, we were able to write Paxlovid, medicine that was used to treat.
You can do that? So how does that work? If somebody calls and says, they walk in and you test them and they're positive and you prescribe Paxlovid for them? Because I got prescribed it by my doctor.
And that's what a lot of times it is. Like Walgreens isn't necessarily set up in a good enough way where I can do what I'm allowed to do, which is write the code and write these sorts of things. It's based on a test to treat platform. So patient comes into my pharmacy, they say they feel sick, they've got a temperature of 102 degrees. This patient's sick. First thing we do is let's test you for COVID. We'll swab their nose, if it comes back positive, and I have a test and treat protocol in place where I can write slowly. That sort of thing. Yes.
What do you do on a daily basis?
So, okay, most of the time, if it's not arguing with doctors about certain medicines, I don't know how familiar you all are with the show Painkiller that came out a couple of years ago, and it was a show. I don't know if everyone's seen it, but it was a show that was based on the opioid crisis in the country and all that. And unfortunately, Surrey County, North Carolina, was one of the highest rates of opioid overdose and opioid abuse in the entire country. So it's my job and the jobs of other pharmacists in the area to control that. And the big dilemma in pharmacy is, well, like oftentimes Walgreens will get a big lawsuit because of an opioid crisis or something like that happens. The question is whether or not is that due to the pharmacy who dispensed the medicine, is it due to the doctor's office that prescribed the medicine in the first place, or is it due to the patient themselves? It's a big dilemma that we have in pharmacy right now. So a lot of my job has to do with controlling opioids. In the pharmacy, has everyone been in a pharmacy? Has everyone seen what a pharmacy looks like? Okay. So there's a countertop, right? And that's where you want to pick up your medicines. Usually somewhere hidden in the back is a big safe where you put all of your controlled medicines. And doesn't matter. They do it mainly for avoiding robberies and that sort of thing. But mainly just checking on inventory, on controls, and then helping patients as they come up. Most of the time, if you have a question about a medicine or something that you have going on, my foot hurts. The main thing that you're going to go do is most of the time you're not going to schedule a doctor's appointment, wait an hour in the waiting room for it. Most people will just go into the pharmacy and say, hey, I have this.
I thought you said, when you said a doctor's office instead of waiting an hour, I get that. I thought you meant like ER.
Well, that too. That was weird.
I haven't ever waited an hour in ER. Yeah, no, my doctor, when I had it on the retina, he sent me this, you need to go to the emergency room immediately. So I'm in the emergency room, I was there at 11 o'clock, at 6 o'clock, I saw a doctor. Then I had to hang up all these things. They're saying, I'm not gonna make it all about me. Go ahead.
So there's a workflow, let me just finish it. There's a workflow that we do throughout. You start by receiving a prescription from a doctor. Doctor wrote a prescription for this patient, usually it's one of our patients. I have to check that prescription when it comes to my pharmacy and right before it gets in a bag and it's written for the patient. So what am I checking? Prescription comes in on a computer, they call it a fax, but it's more like an electronic image. And you're reviewing things, like is this the right patient? Is this the right drug? Is this the right prescriber? Is what they're writing for making sense? If the story makes sense, then it goes on to the technicians and they fill that prescription and it comes back to me and I just verify that the product that's in the bottle that they gave me is the correct product.
Okay, weird scenario. What if the patient is taking medicine daily, like this is something they have to take, and they need a refill? So they go to their doctor, the pharmacy receives the fax. What if they don't receive the fax?
Like if the doctor's office sends a
What if,
prescription.
no, what if the doctor didn't, like, they just not send it through?
No, and I'm gonna weigh in, I Saturday called to get a refill on my Temple. Well, Monday, so they said it'd be ready on Thursday, so by the time Wednesday came around, I called them up and they said, we've sent 4 requests to the doctor and we haven't heard back. And I said, who's are you sending the request to? And they said, it's Dr. Hayes. I said, Dr. Hayes hasn't been my doctor in 2 years. He's retired now. So when you're sending messages to the offices, you're not gonna get a response because he's retired. And I talked to the pharmacist and I said, my new doctor is so-and-so. And he goes, that's fine. And so I contacted. In the meantime, I had gone on like My Health and notified my optometrist, anyhow, my eye doctor, that they were gonna get me contacted. And so she immediately sent a message to me, and then she immediately sent a message to the pharmacy because I said you need to go to CVS and King. And in 5 minutes, the whole thing was. But I had run out. It's just eye drop. It's not like it's a real serious medication.
Well, sometimes it is a real serious.
Well, yeah.
It is a concern sometimes. We deal with that a lot, actually. It's sometimes, well, like what Mr. Angus said, we have a way in our system, in any pharmacy system, to kind of contact the doctor. If you've ever called your doctor's office, or done it for someone that you know about, and they say they need a refill, for example. If you call that doctor's office, they'll say, call your pharmacy for refills, and they will handle it. So that normally means we have to deal with it. So let's say we have a prescription from 2021. Mr. Mingus is asking for drug X, and he wants us to send it to his doctor. Well, okay, the only prescription we have on file is one from that doctor, so we send it to that doctor's office. Little do we know it, his doctor's been closed for 2 years because it happens a lot more than it should, probably, and it's one of the things that's more.
Very sorry.
Did that answer your question? Yes.
I feel well because you were talking about opioids. So I'm in interactive level with the voters club, and they have an issue with opioids, and they want to. I was attending a meeting, and they had a guy come in and talk about opioids and the epidemic, and their new plan has been having disposals they said that people regulate disposable opioids freely, and they got the water supply and stuff like that. And since you mentioned opioids, I was just asking, you're gonna do something like that with
All the time. It's one of the number one things that we worry about as pharmacists. It's, like I said, in Surrey County in particular, it's pretty bad right now, the opioid crisis. And in my personal opinion, it has a lot to do with how prescribers are writing these medicines. Meemaw had a broken hip 10 years ago, and she's been on oxycodone for 10 years. And she just keeps complaining that her pain is hurting worse and worse and worse, and so they prescribe more and more and more opioids. The biggest concern about that is the fact that as pharmacists, we were trained how that drug works. Oxycodone and other opioids, it's really interesting. So you have a drug, right? And in your body, in your cells, you have receptors for these drugs. Opioids have it, marijuana has it. Any drug that you have, the cell in your body has a way to receive that drug. Sometimes if you've been on oxycodone for 10 years, that receptor, when the drug comes in, it's so oversaturated because it's had oxycodone for 10 years that it's not working anymore. And so they get more and more prescriptions. What they don't realize is that oxycodone, in its nature, will actually increase pain. There's been studies that have shown that oxycodone taken over a long period of time will actually increase patient pain versus decrease it. There's another study that was done that showed that oxycodone and taking Tylenol and ibuprofen for someone's acute pain. And they showed that Tylenol and ibuprofen actually work better than an opioid medicine for treating pain. So it really shows you a lot about, well, do these opioids even really work, is the question. And unfortunately, a lot of urban areas, a lot of more progressive areas in medicine